Okay, so let's say you followed my tips and you decided on a primary care doctor to see. Now, what do you do to prepare for the visit? At your first visit to a primary care doctor, there are several things that you should do to make the most out of your visit and to establish a good relationship with your new healthcare provider. Here are some tips. Fill out new patient paperwork ahead of time. There are almost always forms to fill out ahead of time before seeing a doctor for the first time. Now, some providers will read through this ahead of the appointment to prepare for what they want to discuss. Some will read it in the appointment with you, and some may just need it for their records. Either way, it's important to fill out their paperwork ahead of time. Bring your medical records. If you have medical records from any previous healthcare providers or hospitals, bring them with you to your first appointment. This really helps your primary care provider get a better understanding of your medical history and make informed decisions about your care. Bring a list of medications. Make a list of all the medications you're currently taking, including prescription medications, over-the-counter medications, and supplements and vitamins. This can help your doctor ensure that there are no potential interactions or side effects between what you're taking already or what they will be prescribing you, and they can adjust your treatment plan accordingly. Be prepared to discuss your medical history, including any past conditions, surgeries, and hospitalizations. Your primary care doctor may ask about your family medical history as well, and I hope they do, because that's my specialty. But if they don't, make sure to let them know if there are medical conditions in your family. You should tell your primary care doctor as much as you can about your family medical history, just in case you need any referrals to any other specialist based on that history. And hopefully you'll get referred to a genetic counselor if you do have a strong family history or risk for a condition, but more on that in another video. Discuss any current health concerns. Make a list of any current health concerns or symptoms that you are experiencing, including when they started, how long they've been going on, and any factors that seem to make them better or worse. Ask questions. Do not be afraid to ask questions about your health or your treatment plan. There's no stupid questions when it comes to your own health care. So please ask questions. Your primary care doctor can provide valuable insights and advice to help you stay healthy and manage any medical conditions you may have. At the end of the visit, you can request an after-visit summary or AVS with written instructions and let your primary care provider know if something doesn't make sense to you. Schedule follow-up appointments. Depending on your health status, your primary care provider may recommend follow-up appointments or tests. Be sure to schedule any necessary appointments before you leave the office, because otherwise you'll probably forget or it just doesn't get done. And just put it in your calendar, even if it's months out. And if you need to change it, you can call them and change it in the future. But make sure it's on your calendar so you have that marker there to remind you to go back in. Because sometimes it's really hard to get another appointment when you need it.